here. So I'm here again with another video, right? So each and every individual experience, a period of turmoil or stress. So very difficult to manage the stress. We use the various coping mechanisms to cope with it. Okay, we try the various techniques to cope with the stress, but still people may end up with the mental disorders or the physiological effects that can be seen in a person who is having a lot of stress and anxiety as well as fear. So we have got a therapy which is going to help to manage the stress in an individual. So today I'm going to talk about the topic, the relaxation therapy. So, what is this relaxation therapy? So, it is a kind of a relaxation training that an individual will use for himself to quiet his mind or to attain the level of calmness, right? Through this method or through this process, the individual will be able to attain the increased sense of calmness or otherwise reduce the level of the pain, anxiety, stress, and anger. So, that is about the relaxation therapy. It not only helps to reduce our anxiety or the stress, but if you see the physiological effect of this relaxation therapy, it is going to reduce the muscle tension, it is going to lower the blood pressure, slow down the heart rate, and even the breath rates. Okay, that is the physiological effect how the relaxation therapy is going to help. And let us move on to the definition of relaxation therapy. Relaxation therapy is a broad term which is used to describe the number of techniques which are going to promote stress reduction, eliminate the tension throughout the body, and a sense of calmness as well as peaceful state of mind can be attained. So that is the definition of the relaxation therapy. So through the relaxation therapy, an individual is going to attain that sense of calmness. It's going to reduce all his tension, bring about calmness and peace in the mind of the person. Let us see the purpose of relaxation therapy. The goal of the relaxation therapy is to calm down the brain and to permit the thinking process, which should happen in a smooth pace, and also trigger the relaxation process. So, what are the purposes of the relaxation therapy? Number one, it is going to improve the circulation, right? So, when a person is relaxed, he feels calmer, and the circulation inside, the physiological effect is going to cross a improvement in the blood circulation. The second purpose is to relieve the muscle fatigue. It is going to improve the overall physical and mental health of a person. It is going to improve the physiological functioning in an individual. So various systems that we have, the cardiac system, the respiratory system, so the neurological system. So various systems which are interconnected. So all those systems are going to improve their function when the person is getting the relaxation therapy. Moving on to the benefits of the relaxation therapy. We have got enormous benefits of relaxation therapy. Number one, it is going to increase the self-confidence of the person wherein he will be able to manage the various problems, right? So an individual at times he needs to face a problem, so he becomes very anxious, he becomes very stressful. So if he is using this relaxation therapy, it is going to boost his self confidence, and he will be able to manage the various problems or the stressful situations. The second benefit is it's going to suppress the tension and the anger. So when a person is using all these relaxation technique or the various methods of the relaxation, it is going to calm down the person, okay, mentally and physically. So wherein the tension as well as the anger can be managed. The third benefit is it's going to increase the blood circulation to the primary muscles. We use various techniques here in relaxation therapy. All these techniques are going to increase overall the blood circulation and specifically to the muscles, where it is going to reduce the muscle tension and the fatigue. Relaxation therapy is going to regularize the heart rate. It is going to lower the blood pressure. It is going to increase the concentration as well as the memory in an individual. It is going to reduce the sleep deprivation. So at times, when a person is, stressful, okay, is mentally tired, so even he may not be having proper sleep, he will be suffering with insomnia. So a relaxation technique, when an individual practices, it's going to reduce the chances of the sleep deprivation. So he will get a better sleep. So when he gets a better sleep, then if he will get a fully fresh and he will be rejuvenated, right? So that is another important benefit of the relaxation therapy. The next benefit is it's going to increase the energy. Yes, it's going to boost up an individual, it's going to reduce all the muscle tension and fatigue, it's going to give a lot of energy in an individual, okay, enthusiasm, so that he can carry out his activities. The next benefit is it's going to reduce the frequency and severity of panic attacks. So at times when a person is stressed, right? So that stress is going to cause a lot of anxiety at times, no acute panic attacks that an individual may experience. So when if an individual is practicing these relaxation techniques, okay, it is going to reduce these attacks of the panic anxiety. Next is it's going to increase the ability to focus, right? So focusing, to pay attention, concentrate on the activity, whatever you're doing. So if you're stressed, if you're having a lot of tension, you may not be able to focus on your work, you may not be able to focus on your responsibilities. So if you're following all the relaxation therapy, it's going to help you to focus, you're going to concentrate and do a better job. So if you see the benefits according to the system wide, so okay, what are those effects of relaxation therapy on the respiratory system? Number one, it is going to reduce the breath rates or the respiratory rates. Okay, it is going to reduce or slow down the respiratory rate for about 4 to 6 per minute. Okay, so that is the effect of the relaxation therapy once it is done on the respiratory system. The heart rate, if you take, is going to slow down to about 24 beats per minute. Okay, so that is the effect of the relaxation therapy on the heart rate, wherein it's going to just reduce the chances of the tachycardia. The blood pressure decreases, the metabolic rate of a person, okay, also decreases. So the effects, if you take on the physiological functioning, okay, so all those major respiratory rate, the heart rate, blood pressure, everything slows down, which is going to make a calm physiological state in a person. Moving on to the effects on the brain as well as on the behavior. So what is the cognitive and behavioral effects of the relaxation therapy? Number one, it is going to cause the mental alertness. It's going to make a person to think actively, right? So the thinking process will improve. It is going to increase the creativity of a person, the memory of a person. It is going to increase the ability of concentration, to focus, to pay attention. It is going to improve the ability to adapt to various situations. So the adaptive functioning can be attained via the relaxation therapy. So that is about the benefits of the relaxation therapy. Let us see the elements of the relaxation therapy. So if you take a relaxation therapy, what are the elements which are required? Number one, for a relaxation therapy, we require a good, quiet and calm environment. The second element, which is very important, is the mental device. Okay, so what is this mental device? So it is nothing but it can be in the form of a phrase, it can be in the form of an object or a word which is going to make the person to relax. So basically we have got the two main mental devices which are commonly used. One is the mantra, right? So mantra is nothing but it is the word which a person will use in the relaxation therapy, and also the process of the relaxation therapy which happens via deep breathing technique and exhalation slowly. Okay, so this is the mental devices which is required for the relaxation therapy to go on. A word or a phrase or an object mainly used in the form of mantras and techniques of deep breathing and relaxation. The next element which is required is the passive attitude. So here the passive attitude is nothing in the form of an action that has to be done, but the attitude or the thought itself you're going to, inculcate, which is going to help you out in the relaxation. Say for example, if you're having a passive attitude about exercises, so what is this here? You're not going there and doing an exercise there, but the passive attitude about even thinking about the exercise, how it is going to reduce your stress or to manage your tension itself, is the one which is going to make you calmer, right? So the passive attitude about the relaxation technique is another element which is very important. The last element is the comfortable position. So whenever you want to undergo a relaxation training or a therapy, you need to have a comfortable position, okay, wherein you're going to practice all the various techniques. So this is about the elements of the relaxation technique. So moving on to the actual method of how the relaxation technique should happen. We have got various methods of relaxation therapy. Number one, Jacobson's progressive muscle relaxation technique we use. Then we have the mental imagery, the meditation, yoga, biofeedback therapy, the physical exercises, as well as the deep breathing exercises. All these are the various techniques or the methods of relaxation therapy. Let us learn about each of these methods in detail. The first one is the Jacobson's progressive muscle relaxation technique. It is the most often used relaxation training which was developed by the psychiatrist Edmund Jacobson. In this technique, the client has to undergo the relaxation by practicing deep muscle relaxation training. So we have observed excellent results of practicing this progressive muscle relaxation technique, wherein it's going to, reduce all the muscle tensions, anxiety. It's going to be helpful in insomnia treatment, treatment of depression, treatment of fatigue, irritable bowel syndrome, muscle spasms, neck and back pain. It's going to help you out in treatment of hypertension or high blood pressure, and also is going to be a helpful method in treatment of mild phobias. So these are some benefits, or we can say indications, where the progressive muscle relaxation technique has been very helpful. Let us see the procedure of this progressive muscle relaxation. The first step that you have to ensure is to make the patient to attain or assume a comfortable position. The second thing, you provide a light music to the client or a soft music with the pleasant visual cues. Okay, it can be either of the thing, the visual cues, or it can be the soft music which is going to calm down the client. That is the second step. The third step is you're going to give a brief explanation about this progressive relaxation technique. So as you know, we have got so many groups of muscles. So each group of muscles has to be relaxed. So that is why the name progressive muscle relaxation therapy is given. Progressively, one after the another, okay, each group of muscles will be undergoing a tension as well as the relaxation. So here, the next step is you instruct the client to tense each group of muscles for approximately a period of 10 seconds. So you have got the facial muscles, the muscles of the eyes, the muscles of the shoulder, the back, okay, the abdominal muscles. Likewise, each and every muscle, okay, progressively one after the another, you have to make the client to tense the particular group of muscles for a period of 10 seconds. So when the client is doing this, no tense of the muscles, okay, he's going to contract all his muscles. As a therapist, you're going to give a verbal cue to the client that, so see how difficult your muscles are. Your muscles are undergoing a lot of tension. You're going to continuously give a instruction or a explanation to the client that each and every muscle is undergoing lot of tension right now, and your body is feeling so uncomfortably. Each and every part of your body is so uncomfortable, it's so tensed. So that is what is the therapist going to do. Is going to give a verbal cue, or is going to continuously instruct and keep saying to the client that this is what is happening to your body. You're feeling very heavy, you're feeling very tensed, you're feeling very uncomfortable. Each and every muscle is tensed right now. So after the period of 10 seconds, okay, each and every group of muscles, 10 seconds you're going to tense, and another time, okay. So after tensing for 10 seconds, you're going to ask the client to just relax. You as a therapist, you're going to instruct the client, you're feeling very calm, you're having no tension in this particular group of muscles. Say for example, you give a tense or a contraction to the muscles of the eyes, okay. You tell him to contract his eyes. You just explain that your eyes are very heavy, that you're feeling very much tensed right now. For 10 seconds the client will tense his muscle, but after 10 seconds, okay, you're going to make the client to just relax, and you're going to instruct him to relax, take away all the tension from your eyes. You're going to become more relaxed, you're going to release all the tension. Slowly you release your muscles of the eyes, try to relax, right? So like that, the client is going to undergo a relaxation uh, period. Okay, so like that, each and every group of muscle has to undergo a tension and a relaxation. So at the end of the progressive muscle relaxation training, the client fully feels that his body is free from the tension. He feels that comfortableness, he feels that rejuvenation which has happened. Okay, so that is the technique of progressive muscle relaxation training, which is widely used for the relaxation. The next method is the mental imagery. Mental imagery is a relaxation method which is used by the client, wherein he is instructed to imagine certain pleasant, relaxed memories of his past. Such images, when he imagines, it will allow the client to enter a relaxed state and experience a feeling of calmness and tranquility. Okay, so that is what is mental imagery is going to do for a client. Now, what is the image that they're going to imagine? Okay, they can imagine anything in the world, right? What they feel pleasant. Okay, they can imagine about the nature, they can imagine about the ocean or the seashore, they can imagine a pleasant memory in the past which had happened in their life, or a childhood. Okay, so anything which makes the patient to feel pleasant. Okay, that things or those images that they have to imagine. Okay, that is what is done in the imagery or the guided imagery. So that is about the imagery. Moving on to the next method, which is meditation. What is this meditation? Meditation involves the use of certain phrases, words, sound, prayer, objects, visualized image, breathing, or consciousness in order to increase the awareness of the present scenarios or the present moments and promote the relaxation, reduce the stress, and also enhance the spiritual growth. So, what is this meditation? It's nothing but a person will use any form of the word or phrases or a prayer which is going to calm down the client, which is going to reduce the stress. It is going to also improve the spiritual growth in a person. So you have seen many of the people who will be using this meditation. Okay, will be very closely connected towards the spirituality. Let us see the purposes of meditation. Number one, it's going to promote the well-being of a person. So overall well-being of a person will be enhanced. It is going to reduce the level of the anxiety as well as depression if the meditation has been followed. It is going to give more enjoyment in a person, and also he will appreciate the life. Not only that, it is going to facilitate a greater sense of calmness, empathy, and also acceptance of self and others. Okay, so these are the purposes of the meditation. So if you see the benefits of this meditation, it is mainly being very much useful for treating certain mental disorders like panic attacks, anxiety disorders, substance abuses, and also in certain conditions like Parkinsonian disorders and epilepsy. So, in all these conditions, it is found that meditation is really going to help out. We have got mainly the two types of the meditation, right? So, going to see the types of meditation. Number one, we have concentration meditation. Number two is the mindful meditation. Now, what is this concentration meditation? So, as the name says, concentration is nothing but to focus. So, here an individual will use this technique of focusing. He focuses his attention on certain aspects. It can be on his breathing, or it can be on the imagined, image, or it can be a real image, or he can just concentrate on a particular sound or word or phrases which is repeated slowly. Okay, so this is about the concentration meditation. Many of them use this concentration meditation. They just concentrate and focus their attention on the particular sound or on their breathing or on the particular object which is imagined. So that is the one type of the meditation. The second type of the meditation is the mindful meditation. So what is this here? It involves becoming aware of the entire field of attention. So you're going to pay attention to the various field of attention. So it can be about awareness of our thoughts, awareness or focusing our attention on the feelings, on the perception or sensations that are going to arise from moment to moment. Okay, so that is what you're going to pay the attention on, the overall field of thinking, feeling, sensation, so all these aspects. Okay, that is called as mindful meditation. So these are the two methods of the meditation. Moving on to the next relaxation therapy, which is the yoga. Yoga is an ancient system or a program of which is going to make the person to attain a state of relaxation. It's going to integrate the mind, body as well as the spirit. So what is done in yoga is we'll be practicing a system of breathing, physical exercises, and postures, various postures which will be maintained, and also a bit of meditation. Okay, so all these are going to integrate the mind, body, as well as the spirit or the soul. So, as I told, yoga is going to use the various physical postures which are known as asanas. Okay, so these yogic terms, we can say the physical posture which an individual will assume is called as asanas, and the breathing technique which they follows is known as pranayamas. And also the meditation technique which is used to promote the relaxation and enhance the flow of vital energy, which is called as prana. Okay, so the vital energy is going to improvise, which is nothing but the prana. So it is very much important that the nurse should have at least a basic knowledge about yoga, since yoga is an Indian system which is used from the ancient time for the treatment of various stress or the tension. Very much important that a nurse gets a training program wherein she can help out the clients. So now if you take the overall yoga, we have got the very important 8 steps. Number one step is the self control. It is nothing but the yama. Okay, so yama. So the self control has to be the first thing that the individual has to manage. So when I say the self control, it's nothing but to control the emotions in a person. It can be chastity, it can be the non stealing behavior or the non violence, following the truthfulness and avoidance of greed. So all these are going to make a person to have a self control. Okay, to control violence, to control the greed, to control is chastity and stealing behavior. So this is nothing but the second step is religious observance. So, what is this religious observance called as niyama? So, an individual is going to practice some niyama which is very much close to the religious practices. It can be chanting of a Vedic hymn, or it can be austerity or purity, as well as the contentment. Everything which is closely associated with the spirituality or the religion. Okay, so that is called as the niyamas. The third step is the assumption of certain positions, which is called as asanas. The fourth one is the regulation of breath. Okay, it is known as pranayama. So it is a breathing technique with the controlled exhalation, inhalation, and temporary suspension of breathing. So these are the practices which is done in the pranayama. Next is restraining of the senses, okay, which is called as pratyahara. Okay, so we have to restrain all the senses. The next step, the sixth one, is steadying of the mind, which is called as dharana. So, dharana is done by fixation or focusing on some part of the body. It can be the nostril or the nose or the navel. So, you're focusing on that and you're going to do the dharana. The next step is the meditation. Okay, meditation is called as dhyana. So dhyana is done wherein you're going to concentrate on a particular phrase or an object or on a prayer. For example, it can be a true object of knowledge or the supreme spirit by excluding the other things in the life. Okay, you're going to concentrate, you're going to meditate on the particular. The last step is the profound contemplation, which is called as samadhi. So here what happens is the complete absorption as well as detachment from certain aspects like being insensitive to heat or cold, pain and pleasure. So that is called as samadhi. So these are the 8 steps which are followed in the basic yoga. Moving on to the next relaxation method, which is the biofeedback. So, as the name says, biofeedback. So, bio is nothing but the physiological changes which is happening in a person. Okay, so these physiological changes will be monitored, and the monitor will give the feedback to the individual related to the physiological status of a person. So, here what is happening is the individual or the client will be connected to some machines or to some monitors which are going to monitor the physiological effects. It can be related to the heart rate, the blood pressure, the respiratory rate. All these things will be monitored, and those monitor is nothing but it is going to give a feedback to the therapist that what kind of a effect, the physiological effect the individual is undergoing. So at times of stress, maybe the feedback, maybe it may show a high rate in the breathing or the heart rate, the bp may be high. So once a therapy or some relaxation is given, again, okay, because of the relaxation meditation or some kind of guided imagery, what happens, the heart rate will slow down, the respiratory rate will slow down, the bp will reduce. So through the help of a monitor, we will be able to get a feedback how is the physiological changes which are happening in the person. It is also known as the mind and body therapy, because we are going to get what are those physiological change which has happened because of the mind. Okay, so when a person is stressed, when a person is very much anxious, how is the body reacting? Okay, so that we will get the feedback. Now, what is the purpose of the biofeedback therapy? It is going to enhance the individual's awareness of physical reaction to physical, emotional, and psychological stress, and the ability to influence their own physiological response. Okay, so that is the purpose or the benefit of the biofeedback therapy. Now, what are the indications of biofeedback therapy? It can be used in clients with hypertension or the high blood pressure. It can be used in eating disorders, anxiety disorders, substance abuse, attention deficit disorders, depression, sleep disorders, migraine headache. So, in all these conditions, we can use the biofeedback. It is going to give us the feedback how are the physiological effect happening because of the changes in the. What are the equipments used in the biofeedback? So I was saying that we will be getting the feedback via the monitors and all those. So what are those equipment which are used? Number one is the electronic instruments which are used to get the immediate feedback to the patients regarding his or her physiological effects. So, example of these electronic devices, it can be the ECGs, wherein you're going to monitor the ECG wave, the activity of the heart. It can be the EEG, electroencephalogram, the pulse oximeter, the BP apparatus, galvanic skin response to check the effect of sweating, to check the effect on the skin. Okay, all these are some of the electronic devices which are used in the biofeedback therapy. The next relaxation therapy, we have got the physical exercises. You know very well, when a person is doing the exercises, how it's going to have an effect on the body. So, exercises are going to make a change in the physiology, right? So, when a person is exercising, there is a happy hormone which is released. Okay, so we call it as endorphins. So endorphins are the one which is going to make the person feel pleasant, relaxed, calm. Okay, or not only endorphins, you have got various neurotransmitters which will be released when a person undergoes an exercise session or an activity session. The endocrine system is going to release these hormones, are going to release these neurotransmitters, which are going to have a major effect in calming the patient. So, regular exercise is the most important and commonly used method for relieving the stress. It provides a natural outlet for the tension, which is produced by the body at the time of the flight or fight response or the reaction. We have got various forms of exercises. We have the aerobic exercises, which is going to have a improvement, or is going to strengthen the cardiovascular system. So after the exercise session, the person feels relaxed and he will be in a state of calmness. Okay, the last relaxation technique or the method we have is a deep breathing exercises. When a person is very much stressed, okay, or is undergoing a lot of tension, so during that time when a person is taking deep breath, okay, it's going to increase the intake of oxygen, wherein the tension can be reduced. It is mainly used for reducing the various forms of anxiety, depression, irritability, fatigue, as well as the muscular tension. Let us see the technique of deep breathing exercise. So, first thing is you make the client to sit or lie down in a comfortable position. You ask the client to inhale take the breath, inhale through the nostrils and exhale through the mouth. When you ask the client to inhale, you ask him to keep one hand below the ribs, okay, through the one nostrils. You ask the client to take the breath so that his ribs will expand outward. Okay, so likewise, you ask the client to inhale. So the exhaling is through the mouth. So when he is doing the exhaling, the hand will fall back to the original place. So if you take the duration of the inhalation and exhalation, the duration of exhalation should be double that of the inhalation. That means the exhalation process should be taking more time compared to the inhalation. So that is about the deep breathing exercises. Moving on to the role of nurse in the relaxation therapy. The first thing is to help the client to recognize his stressors. So very much difficult why an individual is irritated, why he gets angry. So the cause itself is the one which is going to help the client, right? So what is the reason behind the particular stress? Okay, you need to help the client to identify his stressor. The second thing is you're going to make the client to identify the method of coping. So you give him like these are the various techniques of relaxation we have. So what is the best thing for you? What do you feel is the best? Which one you want to use for coping? Okay, you make him to identify what is the coping mechanism that is required from him. Let him make the decision to choose his own therapy. Next, you identify the individual's ability to adapt to the stress. So, what is the ability of the client to adapt to the various stress situation, right? Stressful situation. What is his ability to cope or ability to adapt and to manage during various situations? The next thing is you're going to assist the individuals to achieve their highest potential of well-being. Okay, you're going to help out the client to reach to that high level of well-being. The next thing is you're going to evaluate the effectiveness of the therapy, right? So how effective the relaxation therapy was to the patient, you're going to evaluate whether it was effective or not, whether he requires any other type of the method for reducing his no stress or the anxiety. Okay, so if so, how he has to follow this, and how he has to keep this as one of his routine. So all these things you are going to find out to evaluate the effect of the therapy. The next thing is you're going to plan the alternative, or you're going to do some modifications. So as I told you, if the particular relaxation therapy is not working out, you're going to change or modify the particular technique. You're going to give an alternative to the client. Okay, the next responsibility is throughout the therapy, you're going to be giving a supportive role. You're going to encourage the client, you're going to motivate him, you're going to support him, okay, and make him realize that, okay, the stress has to be managed, right? That he has to be under his control. He should be able to manage his emotions, the self control ability that he has to get. So give him the constant support. Okay, that is the major role of the nurse. The last one is nothing but the documentation, very important when you are in the therapy session. So, what is the response of the client? Okay, what type of a therapy was given? How effective was the therapy? Whether any modification was done? Okay, so when should the client undergo the next therapy? Okay, all these things that you're going to monitor. Okay, any untoward reaction or experience the client had, how was his behavior? Okay, all through the observation you're going to report and you're going to document. So overall, you can imagine, even as nurses, we face a lot of situations which are anxious, okay, which are very stressful. It's not only to the people who are emotionally or mentally weak, but also any individual who undergoes some kind of a stress or some kind of a situation, feels very much anxious, they can follow these techniques. Okay, it is not that only it is limited to certain individual. No, each and every person can follow these relaxation techniques, which are going to improve the well-being in a person, which are going to make the person feel confident about himself. Okay, hope you all have understood the topic. Thank you.